So this afternoon is a special session for demonstration of laser hemorrhoidoplasty with FGHL on models. There are various Ayurveda surgeons who want to learn laser surgeries, especially hybrid techniques. In hybrid techniques means which is a composition of Ayurveda procedure and the technology, that is the laser. So this is Dr. Sachin Gupta from Patanjali Ayurveda Hospital. We invent very good techniques, that is minimal invasive technique at our institution, and I am now going to demonstrate this on this model. Especially any surgeon who has to go for this laser proctology must to have practice on models. That is very important, and also the choice of laser machine. It is very important for doing this type of procedures. So for this case we designed very good models. You can see here there are various models. Various models. Chivates you can also open. There is various models. I'll show you the models personally. This is the Chivates model. Clearly see, this is the Chivates model, and with this model we can give practical learning of how to do Chivates procedure. Especially this is the Chivates proctoscope and this is the Chivates model. Chivates model is nothing but the model in which we can go with the 2-layer hemorrhoidopexy, especially with the interval of 4 centimeter, that is 2 centimeter and 2 centimeter. We are creating a ligament of trees, especially that is the artificial ligament of trees. In that the purpose of to create this ligament of trees is to block all the collaterals first. If collaterals are there, there must be a recurrence. Number one. My opinion, with my experience, I told you Chivate procedure is the excellent procedure with Shara Karma. And laser is also, we invent a very good technique which is a mixture of laser and Shara Karma. How much energy is to be delivered? Number one is the concept behind that. And number two is the how Tikshna Shara is. There are two prospectors in that technique that I'll demonstrate in my OT session. Now I am going to demonstrate FGHL, that is finger guided hemorrhoidal artery ligation. First, come. Concept according to Ayurveda, when I did my post graduation, that is under Dr. Hemant Kumar, my sir is always the demonstration of, there is always confusion in our minds about the dentate line. It should be very important. You should know the proper line of, that is the pectinate line. According to in my PG programs, it is taught like the dentate lines approximate 2 to 3 centimeter above the anal verge. Number one, that is somewhat around here. Okay, but when I join conference of this coloproctology, it is totally changed. The dentate line always very much nearer to the anal verge, that is here somewhat, and there is a columns of Morgane, and approximate from 3 to 4 centimeter away from this area you can feel the pulsation, that is the branch of superior hemorrhoidal artery. Number one. So you should always in mind always should ligate all the vessel all around, that is 3 o'clock. There is a no fixed position of that pile masses. You have to palpate with your finger and then ligate it. Number one. It may be in 3 o'clock, it may be at 5 o'clock, it may be at 9 o'clock, it may be at 11 o'clock, and somewhat 12 o'clock, what I am feeling. So very important step when you ligate at 12 o'clock, in males especially, very important concept is never go deep. Sometime what happens, there is a prostatic vessels always, and you may injure that vessels. And sometime I have seen 2-3 cases, there is some prostatic vessels also. Is the line. So this is the 9 inches needle holder. I'll show you. This is the 9 inches needle holder, and this is the thread what we are using. So this thread is of Cubics company. This it is 2 by 8 circle, that is 5 by, pardon, this is 5 by 8 circle and 120 centimeter long thread. You can clearly see on camera. So this is the thread what I am using for. I'll go for demonstration now. So this is the finger. You have to introduce your finger like this and palpate the vessel first. It is very important, you should rotate your this needle approximate 3 millimeter, including 3 layers, that is mucosa, submucosa, and some fibers of internal and sphincter muscles. So I'll go for demonstration. So this is the dentate line. So approximate, it is 3 to 4 centimeter inside, and gently you should introduce like this. Okay, number 1. Take the needle out like this. Again, take out your thread like this. Again, you have to go for the same angulation. This movements of needle holder is called as supination and pronation movements. So like this. You should not go deep. Sometime what happen, you may injure the internal and sphincter muscles.
This is above the anorectal junction or below the anorectal?
See, this is below the anorectal junction especially, and
Figure of 8.
it is the suture which is in the figure of 8. And especially do not be panic when you see the bleeding inside. Always use the compression formula, that is very important. When you compress that, I have seen many cases when I puncture the, in the beginning cases I puncture the vessel. So some surgeons are very panic when seeing the hemorrhoidal artery. There is a huge gush of the blood inside, I have seen. So do not be panic, just compress like this. If you got or if you puncture the vessel, you should always compress like this and wait for a minute always. Then I'll show you the one maneuver is called as how to stop that bleeding. That is very important. And just cut it short. This is called as finger guided hemorrhoidal artery ligation. Next is laser hemorrhoidoplasty. So this is the fiber what I am using. This is called as conical fiber. This is a conical fiber, and this is a straight handle especially. And the setting of this NeoV laser machine is 6 watts 3 seconds. It means you are delivering, there are 3 zones what I am selecting for. One is distal zone, one is mid zone, and one is the proximal zone. That is the roadmap of delivering the energy in the pile mass, in the submucosal plane. So I'll show you. The beauty of this machine is it will stop after 18 joules. So how to enter that through the dentate line? There are 2 concepts. Some surgeons are entering through the dentate line and some are entering through the mucocutaneous junction. So in my practice, first I practice for mucocutaneous junction. I feel sometime hematoma formation especially. So when I choose this dentate line, the chances of hematoma reduces to 1% in 100%. Okay. So this is the dentate line where I am entering. See this. Once you enter into the okay fiber, अंदर डाल दो. फाइबर इंटेंसिटी बढ़ाई है, फाइबर की लाइट इंटेंसिटी. अच्छा, मेथिलीन ब्लू. Okay, you can see the light, or you can see the beam of laser inside. आपको दिख रहा है? Laser inside. So one zone you have to deliver 18 joules now. So this is one section. Again on another section you have to deliver 18 joule. And third one, again I select 3 zones in every portion, that is distal, middle and proximal. Like this, you have to come out and again deliver energy. Again you have to come out, deliver energy. So very important in this, the selection of delivering energy. It depends upon to degree of the bile mass, especially second degree, third degree. Usually in second degree I deliver around 150 joules of energy. Okay. If the bile mass is big or the cushion is enlarged one, I deliver around 180 to 200 joules of energy. It depends. So frankly speaking, nowadays I am doing the hybrid techniques, which is a mixture of Shara Karma along with laser ablation. So with laser I deliver 100 joules of energy, around selection is 70 to 100 joules of energy in the submucosal plane. After application of Shara Karma, it will having the great effects, or it will compress or it will normalize the normal mucosa of the rectum or anal canal. Now like this. So this is the laser hemorrhoidoplasty with finger guided hemorrhoidal artery ligation. Thank you. This is Dr. Sachin Gupta, Patanjali Yogpeeth, Haridwar.